The following is paid for by Advanced Physical Medicine of Miami.
The information presented in this program is for educational purposes only. It is not intended to diagnose, treat, or cure any condition, illness, or disease. The depiction of successful results from the treatments discussed in this presentation are examples of the possible benefits and do not guarantee results. The decision to start any medical treatment should be made only after discussing all benefits and risks with a healthcare provider.
Welcome to Healthy Dose with Dr. Joe. Are you ready to repair damage to your body? Replace what is depleting to regain your youthful vitality? Regenerate what is now degenerating? Dr. Joseph Gambardella is a doctor of chiropractic medicine and an anti-aging health practitioner diplomat. He was the first doctor in Miami to complete his fellowship training in stem cell therapies. As the owner of Advanced Physical Medicine and Rehab of Miami, he provides patients with the most sophisticated and safest treatments in the market today. Join Dr. Joe for the next half hour and learn about the medical advancements that have helped thousands avoid surgery and pain meds. From stem cells to hormones and everything in between. Get ready to feel empowered. Get ready to regain control and reclaim your life. Now, here's your Healthy Dose with Dr. Joe.
Welcome to Healthy Dose Radio. I'm your host, Dr. Joe Gambardella with Advanced Physical Medicine and Rehab of Miami. You can find out more about us by visiting our website, apmrmiami.com, and by following us on Facebook and Instagram at apmrmiami. Our purpose is to educate you about the various ways that the body can regain its innate ability to heal without the use of drugs or invasive surgery. I'm sitting here today with a pretty amazing person. She's a healer herself. Her name's Anita. How you doing, Anita?
Good. Thank you.
And I'm also here with Rob, our office manager. How you doing, Rob?
Very good as always.
Anita, you have a pretty interesting story in that, as I mentioned, you are a healer yourself. You were the co-owner of one of the first Nautilus gyms in the country. Pretty amazing equipment. I remember that when I started working out back when I was 14 years old.
Yes, it was really wonderful. We had the first generation. We had 20 machines and a really beautiful place in Tallahassee, Florida, with health food store and juice bar and bookstore and racquetball courts.
So you've been into health and fitness. I remember you telling me all the way back to your Florida State days.
Oh, yes. I have a degree in physical education, and I taught in middle school, high school first here, and then middle school, and began a master's degree in motor learning and rotor perspectives for women with weight training using the Nautilus equipment. So, yes. Pretty
amazing. And then you got into 39 years of therapy with massage and craniosacral work, and you work with moms and dads and pretty high-end athletes as well, right?
Yes. Generally, what has happened, it's anybody who is ready for change in their lives, and they may not know exactly what that is. It could be injury, it could be emotional, and as well as physical stress. So it's been my passion to assist
helping
others.
people.
Yeah.
And ironically, all this physical work that you do, you found yourself getting into some trouble with your shoulders, your knees, your hips. Why don't you tell us a little bit about how you came to find us and some of the work that you had done prior to seeing us in terms of your...
Okay. Around 2007, my work is rather strenuous. It involves my body in a pretty strenuous way. And so I began to notice a deterioration in my right hip. And that happened over time. And I investigated what options there were. And it was, a hip replacement or something else called a hip resurfacing, which I actually went to India for that because the number 2 man in the world at that time in 2008 is in India.
Oh, wow, that must have been a great experience.
It was incredible. And
what a change in culture.
A lot of people learned about Dr. Bose because he was featured on 60 Minutes in 2005. And Americans didn't even know about this procedure. It wasn't even approved by insurance or anything here. But I decided to go for that. And the cost was much less than here, but I wouldn't have been approved for it anyway. I was considered too old at the time. But
isn't that incredible?
It is. But Dr. Bose just determines your general health, and what he determines is the health of the bone. And so I had that procedure. It was very successful. The care was incredible, and I had an experience in India that I'm very grateful for and never forget.
That's a once-in-a-lifetime experience.
Yeah, it was amazing. And it was my mission to let other people know that there is that option to choose.
And so getting back here to the States, doing some more work, you started to have some problems with the other hip and also with one of your knees as well,
yeah,
correct?
Well, before I had the hip resurfacing, I was having problems with my right knee. I had torn the ACL in 1996, and I was actually concerned that the knee would affect the hip resurfacing, but they straightened everything out, and the knee was okay for a number of years, and I was nursing it along, and but eventually 2017, it just basically collapsed, and so I had to have
You wound up getting that one replaced.
Yes, fully replaced a year ago in March. But I had been so off balance for so long that my left hip had really become severe arthritis and bone on bone. So it was actually one of my own clients who told me about you. She had been to see you for stem cells for her knees, and I literally, at the time I was healing from the knee surgery, didn't have a leg to stand on pretty much.
And the thought of going through it all over again, just as you were starting to recover.
Yes, I didn't want another surgery, absolutely not. So she said, would you just go talk to Joe? So I said, okay.
And you know what, Anita, it's really interesting that one of the most common things that patients will tell us is that they don't want to go through these surgeries, not because of money, because oftentimes it's covered by insurance, but it's because of the huge investment in time.
Yes.
It takes about 6 months to get back to partial activities in the better part of a year, let alone the pain and trying to get all these therapy sessions covered.
Right. Yes. So I took 2 months off of work with my knee, and I went back to work because I needed to go back to work. And but I was in a lot of discomfort and kind of strapped myself up. And but then when I came in to see you, and you explained what it was all about.
And when we work with cases, everyone is treated as an individual. So we did a full examination, took the x-rays, and we were really honest with you that when we saw that hip, it was an advanced case. And it was really your desire to avoid a third replacement that we decided to go forward with this. And we elected to use the biologic allografts that contain the stem cells. We set you up with a program that involved shockwave therapy, high power laser therapy. And really what that is designed to do, these are all tools, all modalities that really engage your body in a quest to heal itself again, because your body was stuck.
Oh, yes.
You were operating at a deficit, so to speak.
Definitely.
And when you have more cells that are dying than your body can generate or replace, that's the definition of degeneration. And the worst thing that can happen with degeneration is to wait. And as you know, because when you're really passionate about what you do, you don't want to take time off. And that kind of leads us into these treatments that are really difficult.
Right.
And yours wasn't an easy one.
No.
Right. So we did the procedure, and just to let everyone know, like this isn't a magic treatment that you're going to feel incredible within a day or two, although some people do. How did you feel after you did your initial treatment?
Well, I was very hopeful that it all made sense to me, and as well as the person that when I was there on my initial visit, and you said, "Oh, there's someone right there that I had seen on your computer as a testimonial," and you said, "Go talk to him." So I went out, and he 3 years before had the treatments, and he said, "I'm great, both hips, and doing anything I want." And I said, "Okay." So
doesn't get better than that. As a
right? No, a
personal
personal person you can really ask and see. I could see what he was doing. So I was just very positive, and a lot of everything is about what you believe, what you choose to believe.
Absolutely,
and I believed that this was going to be, this was going to work. It made perfect sense that these little cells, these brand new baby cells, were going to go in and adhere and start to grow and build and fill in.
These biologic allograft containing stem cells that we use come from umbilical cord tissue. And in terms of regenerative medicine, younger is better. The cells that come from these tissue grafts have never, ever been exposed to trauma. They've never been exposed to any types of medication. So when they enter into your body, they release massive amounts of growth factors. And these growth factors are utilized by your body to start engineering new tissue, new cartilage. And over time, slowly, your body starts to regain its form and its shape. The thing about our office is it's a small part of the recovery, because we talk about repair, replace, regenerate. So we had to repair the structure. We had to work on you physically. Your hips were out of alignment. Your feet were out of alignment. And we did some adjusting on the feet. We fitted you for orthotics. And slowly over time, when there's less pressure because of less rotation on those damaged joints, that's one part of the recovery. And then as these cells started to do their thing, your body started to recover. We hit a point that we were stuck, right? It wasn't progressing as quickly as we had hoped because your degeneration was so severe. So then we added something called prolozone, which we spoke about on a previous show, which was pretty amazing because prolozone is something that really activates stem cells, your own stem cells, because it forces them to release even more growth factors. And how did you feel when we started doing those prolozone injections?
Well, that was miraculous, actually. So I was definitely getting better, and I was able to work, and I traveled actually to another city where I have another practice, and I had worked, which was amazing even before the prolozone, but I was still walking with a cane. And then when we started the prolozone after the third treatment, I was noticing myself just unconsciously walking away from my cane. And I was like, oh, that's interesting. And then it's usually 3 to 5 in treatments. And after the 5th, I had absolutely no pain in my hip. And it was astounding. It just turbocharged those stem cells.
And that's without any medication.
Right.
You didn't take any anti-inflammatory. And that's the key point here, is that anti-inflammatories really stop the healing process when it comes to degenerative conditions. Anytime there's an injury that causes pain, there's inflammation present in the body. And we all grow up knowing that pain is bad. So the first thing that you want to do is reduce the inflammation. And when it comes to these degenerative conditions, it's the worst thing that can happen, because you stop the healing process completely. Inflammation is key, because that's where your body's own stem cells start to respond to the injury. In fact, they zero in on that inflammation and they start to triage, which means assess what kind of damage has occurred. And when enough inflammation is present, these stem cells start to release these growth factors. And depending on where the injury is, your body will utilize these growth factors to start to repair tissue. The type of cells that we use are amazing cells, because they're called mesenchymal cells that come from these tissue grafts. And mesenchymal cells are tissue signaling cells. Depending on where these cells are placed, they will help the body engineer and repair specific types of tissue, specifically cartilage, bone, muscle, or fat. And when you're talking about regenerative medicine, you really want to use cells that are very specific. You don't want cells that can turn into anything. You only want cells that can turn into one of these 4 things. And we wanted your body to be able to receive these cells so it could stimulate the regeneration of that connective tissue. And that's why you started to feel better.
Yes.
Your own body started to release the inflammation. Yes. And I remember you came into the office one day and you were zipping by, and I said, who is this woman? Without a cane. And I said, was that Anita? And sure enough, you were on the other side of the office already, going back and forth up and down the hallways. And
I still remember the first day. That was her actual goal, was I want to get rid of this cane.
Right.
I don't want to be walking around with a cane. I have too much life left in me. And I remember that was your goal. And how long was it before you finally started releasing the cane and walking without it?
Well, it was right about that time after the 5th injection. I was receiving them every 2 weeks. And so, but that was amazing. Yeah.
And you've been one of the lucky ones who's actually had the experience of going through replacement, the hip, and then going through the stem cell procedure. What would you say is the biggest difference between the two experiences?
Of the surgeries?
Of the surgery and then going through the stem cell.
Well, they're very different.
It's almost night and day.
Well, yes, the mechanical, when the joint is just, I waited until the very last minute, when the joint was unable to support me. And stem cells, I don't think, would have been able to assist what had happened. And for my hip, so there is that mechanical support that you feel. But this, I feel like I am much more engaged with my own body and in the process of supporting that. But, and an awareness. Because of what I do, I really can feel things shifting and changing, and I pay attention to that. But I just have to say that what you all offered me, totally, the total care and support, is also what made the huge difference. When I walk into the clinic, just walking in, there is an energy, there's a vibration there that we're here for you, and completely. And that's the way I've felt supported through everything.
And we actually had a pretty big setback not too long ago. Let's talk about that a little bit.
Okay.
Well, hang on.
Alrighty.
We'll take a break,
Okay.
and we'll come back and talk about it. Before we hear about Anita's setback, let's take a few seconds to find out how you can get that relief from debilitating pain with Dr. Joe and his wonderful staff. We'll have more from Healthy Dose Radio in just seconds. Stay with us.
Repair your body. Replace your key hormone levels. Allow your body to regenerate itself without surgery or meds. When it comes to your health, the best plan is preventative. If you wait for symptoms to show, you could be too late. With over 40 years combined clinical experience, all under one conveniently located state-of-the-art facility, Dr. Joe is on the leading edge of regenerative and physical medicine. Take control of your health and get a free consultation and evaluation. Visit us at apmrmiami.com or call 305-598-8788. 305-598-8788.
So we're back with Anita, and she was telling us about how she was starting to feel better. Her hip was recovering, feeling better, getting back to activities she really loved. Went out to Denver, Colorado, and started visiting with a friend. And I think you got on a bicycle, didn't you?
Yes, I got on one of those little fold-up bikes with my friend, and we were going to take a nice little bike ride, but I rode down. I was trying it out. It was, just to see how it felt, and I rode down her driveway and then up the little hill in front of her house. And I realized the seat was too low, and I turned, and my knee was in the way, and I fell over completely on my side. And it was pretty dramatic, and right on my hip and my shoulder, and gouged out my hand pretty well, and road rash and all that. And
I think we could see when we saw you a few days later, I can see why you got into trouble to begin with, because that's probably something you should have gone to urgent care and got stitched up. And just knowing you.
Well, I did go to urgent care because I was concerned. I thought maybe my wrist was broken. Yeah. And but thank goodness, had x-rays, and neither the shoulder or the wrist or anything was broken. And I felt like all the prolozone and the stem cells, I mean, I'm not a young person, and
although you look it for sure.
Thank you. I know I don't have osteoporosis because nothing shattered. I didn't break one bone. I could have snapped my clavicle easily.
And we didn't know. I mean, you came into the office, and then we saw you with a cane, and we said, "Oh my God, something happened. There's been a setback. What was it?" And sure enough, you told us about this injury. We took some X-rays again, and we found out that your hip was pretty severely rotated. It was rotated, your gait was completely changed, and we started to do some work again. And we did a lot of muscle work. There's a pretty amazing technique that we use that involves some neurology that really gets your brain and muscle to engage and to function differently after there's an injury present. And slowly over time, we use that. We use some lasers, which were pretty amazing, and you started to recover pretty quickly.
Yes. I think quite quickly. Actually, it was within 2 weeks that I was back working again. And I had quite a good gouge, and the hot and cold laser on my wounds really helped them to heal, and the other work really brought me back. I was still using the cane and just minimally, just to support, or if I was going to be walking a lot, I would use it just because it would get tired. But I'm pretty much back to where I was before that incident.
And we're doing the show late tonight because you had a full schedule. We were working on patients all day today.
Correct.
And I know they're happy about that, getting you back in the mix, right?
Yes, and I'm happy. So, I'm very grateful for everything that this has been an amazing journey.
And that's why we love going to work every day. It's a pretty amazing practice because a lot of people don't know what physical medicine is. Anytime they hear the word medicine, they think you're a doctor's office that's going to prescribe drugs. And I mentioned some time ago that we saw over 20,000 patient visits last year, and we didn't prescribe one drug. Wow. Yep. And when you come into the office, it's really unlike any other office you've been to because you don't know if it's a gym, you don't know if it's a doctor's office because we have medical suites and there's always people smiling even at the front desk. It really is a pretty unusual thing when you go into the office. Everyone knows your name. And we just have a good time there because it's very empowering to really find something that works for these really difficult to treat conditions. And it's not just one practitioner. We have so many practitioners. We have an amazing physician assistant named Christina. She'll be on the show one of these days talking about what she does. And she's really our go-to. When we don't know what to do, we go to Christina, and she's as I said, pretty amazing.
She is.
I think that's
She's
the
wonderful.
thing that's special really about the office too is just the collaboration of so many different specialties.
Yes.
And what I love about patients like you, Anita, is that you challenge us. You came in with multiple injuries. You had a pretty extensive history. You had a setback that we had, really kept us on our toes, and that just always makes it better. And just to see, this medicine come together the way it has, like you said, we've done physical therapy on you. We've done high power lasers. We've done shockwave. We've used stem cells. We've pretty much exhausted everything that we can offer, and we got you better.
Yes, definitely.
Yeah.
Another thing for me, I think, is sometimes I experience these interesting modalities so that I can share the information with others. I know I let my clients know about you, and, please go. This is amazing. Prolazone's incredible, and go talk to you about the stem cells and just experience the clinic.
And we're so grateful for that. There's so many of your patients actually have come to see us and have done treatments of all sorts. And there are so many different offices locally that offer stem cell therapy, but they're not all the same. And, we like to talk to our patients about getting the right type of cell. There are all different types of ways that you can harvest stem cells. You can get stem cells from bone marrow, you can get them from body fat, and they're called adult stem cells. And really, to keep it simple, those cells are about as healthy as the patients that are walking into the office. And if they're walking in to see us for a consultation, they're not healthy. They've lost quality, they've lost function. And those cells have done an amazing job, but they're just older and weaker. And they're not capable of stimulating the body to repair these chronic degenerative conditions. And that's why we utilize the best type of cells, these biologic allografts that contain these stem cells that release, as I said earlier, these massive amounts of growth factors that your body uses to repair itself. But that's half the battle. And most practitioners in clinics stop at that. And one of my great friends, Dr. Buzz Korth, he'll be on these shows one of these days with us. He gave us a great analogy where he said that taking stem cells, even the best ones, and putting them into a degenerated joint is like putting seeds into sand. Nothing's going to happen. Right. And essentially that's what adult stem cells are doing. They're trying to help the body repair, but they can't. And it's because of where the injury is located. There's not enough oxygen present for these stem cells to release the necessary growth factors that the body needs to repair itself. So we combine that with prolozone and ozone therapy and laser therapy. All of these tools are designed to bring oxygen into the joint. And it's the oxygen plus the cells that really stimulate your body to do some magical things.
Something else that I really enjoy is riding my bike outside, my regular bike, and I hadn't been able to ride it since my knee surgery, and I couldn't even get up over after, and so one of my goals was to be able to ride my bike again. So after the Prolozone began in November, on New Year's Day, I rode my bike to the gym where I work out.
It's a good way to start the year.
Yes. So, yeah.
Started on a high note.
Yeah.
And you've been an amazing patient, Anita, because you never get down. You always come back. You have that smile on your face. You're a pleasure to work with. And you listen to all the things that we say. You didn't take any anti-inflammatories after the procedure. You waited. One of the requirements is you cannot take a non-steroidal anti-inflammatory, an ibuprofen, a Motrin, or Relieve 30 days following the procedure, because that's going to stop the cells from doing what they need to do. You were very compliant. You took it easy with work. And although it wasn't surgery, you had to take it easy for a while.
Yes.
Because you want your body to lay down these new tissues and it needs to become stable.
Right. Which was a challenge to not,
Yes.
because I love to move.
Yes.
But I wanted this to work and to honor what was happening in my life.
And you're not even done yet, because I think you did the procedure, was how many months ago, Rob?
It's about a year
ago.
yesterday,
About a year.
I think.
Just past a year, Mark.
Yeah.
Just past a year. And with the addition of prolozone, with the addition of shockwave, with the addition of laser, these cells are continuing to release growth factors all the way up to 16, 18 months.
Yeah.
So you're not even,
Right.
I won't say close to where you're going to be, but you're not there yet.
Yeah.
And the most important thing that has to be done over time is you just want to keep these cells active. And doing the prolozone, doing the shockwave, doing the laser as boosters, which in the grand scheme of things, Anita, I think you'd say are relatively painless.
Oh, not at all.
And in terms of a cost, everyone can afford it. Most people think that regenerative medicine is something that only millionaires can afford. One of the greatest things that we do is we make this available for everyone. There's a payment plan that everyone can afford. You can take a procedure like this and bring it into a price range that fits into everyone's monthly budget. And I know that was a concern for you when we started.
Definitely. But Robert laid it all out, how it was possible and very, very doable for me on the payment plan.
And even the schedule too, because I know with you traveling so much, that was a concern of yours is, could I fit this into my busy schedule? And that's a beautiful thing about this procedure as well, is that it's the lack of time that it actually takes. I mean, you're coming in 4 visits over spread over 2 months. How much time is that really compared to going to PT twice a week, doing, the whole recovery of a replacement?
Right. But, I mean, I I was barely moving when I came into the clinic, and with the help of all the other therapists, physical therapists, and the support staff, everybody.
I'm just happy to get you back out there doing what you love to do, Anita. So how do people find out about you?
Well, I do have a website, and it's www.anitatouch.com. My name, touch, one word. So I have a website there which gives some history of me, and I'm a native Miamian, grew up here, and as soon as I could walk, I probably was out climbing a tree and just running around barefoot. But I do have an office. I've had practice here for 23 years, and then I wanted to live in the West, and I moved to Durango, Colorado, and then came back recently, about 3 years ago. I have an office in South Miami. So,
well, I'd encourage everyone to look for your website and get in touch with Anita. She is amazing. Just being in her presence, you're going to start to
makes
heal.
you feel better by being close to her.
Yes. Yes.
I feel it. Thank you so much. Well, I love my work, and I feel honored when anyone comes in and invites me into their journey. And because the work that I do practice is a process, it's a series of sessions and sort of like peeling the layers from the outside in.
Absolutely.
So
we're looking forward to speaking to you again, Anita. So stay tuned for future episodes where you will learn more about the different ways to repair your body naturally, on how to replace hormones, vitamins, and stem cells safely and effectively, and how to allow your body to regenerate and heal itself without the use of drugs and unnecessary surgery. Remember, repair, replace, and regenerate. I'm your healthy host, Dr. Joe Gambardella, and I'll see you next time.